Hello everyone, my name is Alexandra Verba. Today is February 7th and this is our last video for anatomy. Today we are going over surface anatomy structures and I am sorry I do not have a second person available to help me show you guys, so we're going to do the best we can. So this is my little cheat sheet. So we're just going to keep it right there on my desk. So in the muscular system, I chose two external features. Both of them are in the upper portion of your leg and are part of your quadriceps. So you have the vastus lateralis, and I did my best to kind of try and outline it for you guys. Down at the bottom there, you can kind of see where it's popping out as I flex. That is one of the major muscles that help you straighten your leg. You also have your adductor magnus, which is on the inside here. You can also kind of see it popping out there just a little bit. That is an important muscle in adducting or adding that leg back to your central mass or to your mid-sagittal line. The other structure in the leg I chose, which is part of the skeletal system, is your patella. And here, that is also known as your kneecap right here. And if you straighten your knee just a little bit, you can kind of see it moving around right there. So that is that bone that sits right on your knee. It's your little patella, or also known as your kneecap. Now, wanting to go into medicine and having worked in the medical field for the last 10 years, the last 5 as a paramedic, there are a couple of external markers that are really important for my job. So one of them is the xiphoid process. And let's check that up a little bit. So the xiphoid process is a little hard to show. But you can see right here, right at the apex of this triangle here, is the bottommost part of my sternum. And if I run my finger up to where that dot is, you will feel a notch on your sternum. And that is the xiphoid process. Now that is super important when doing CPR. You want to go up about 2 inches from that xiphoid process to do compressions. The reason for that is if you are on the xiphoid process, you can actually break that off, and then you have a loose piece of bone floating around that can cause damage to your internal organs as you're doing compressions. The other feature I want to show you is the cricoid cartilage. Now this was actually mentioned kind of in our book when it discussed an emergency airway. So as a National Registry paramedic, placing an emergency airway is something that I am qualified to do. However, that qualification varies state to state. So you can feel, it's a little hard when you're talking because you're obviously things in your trachea and vocal cords and things are moving around. But you can feel your Adam's apple. And if you run your finger below that, you will feel a slight depression or soft spot. And that is going to be your cricoid cartilage. And that soft spot, that membrane right there, is where you would place your emergency airway. Now, there is a difference between a field emergency airway and a surgical airway. It's different in the placement, it's different in the equipment you use. What I was trained on is a kit. You don't have a scalpel to separately slit the skin and that membrane. You essentially just have a giant needle and you poke it right through, but it still provides an open airway. We didn't go over what system those features are part of. So your xiphoid process, the one down here, it's important for CPR. That is in part of the skeletal system, and then your cricoid cartilage is actually part of your respiratory system. It's part of the trachea. So there is a quick touch on some external features of the body, and Hope you have a good day.